Today's ruling, of course, was very unpopular with Republicans in Congress, including our representatives here in Tennessee. Conservative lawmakers are vowing to continue to fight the ruling in Washington. 6 News anchor Gene Patterson spoke with Representative Chuck Fleischman of Tennessee's 3rd District today to hear his thoughts on today's Supreme Court decision.
Well, we're joined now in Washington via satellite by Congressman Chuck Fleischman. And Congressman, thank you for joining us.
Gene, it's always a pleasure to be with you, sir.
I know that I've seen a couple of your tweets and I've seen your news release. You feel like the United States Supreme Court got this one wrong. Why?
They got it very wrong, Gene. This is a disaster for the American people. It's a disaster for patients, for doctors, for our whole healthcare system. Worst of all, it's a disaster for our Constitution and our liberties. I have long felt that Obamacare was unconstitutional. This was a law that they said then needed to be passed so that we could find out what's in it. Well, it's a disaster. For the United States Supreme Court to uphold the individual mandate under the basis that it's a tax is just ridiculous. Even the Obama administration, when they pushed this silly law, this disastrous law, never called it a tax. In fact, they said it wasn't a tax. So it's bad law, it's bad policy, and it's still got to go.
Congressman, there are those who are very happy, obviously, that the individual mandate was upheld. But more, they were very happy that the Affordable Care Act that was passed 2 years ago is in place because of the different provisions about allowing your child to stay on insurance till 26, no pre-existing illnesses to stop you from getting insured, no lifetime caps, those kinds of things that appear to be, at least to a lot of people, very popular. What do you say to those people when you say, and I understand you're going to fight to repeal the whole law?
Well, we can certainly do things to keep provisions of the law, like having children to 26 on the law. My son is 23. I like the fact that I can cover him. I like the fact of covering pre-existing conditions. But, Gene, we've got to focus on the horrific parts of this law. 20 new taxes, $1.76 trillion added to the deficit, and worst of all, a destruction of our individual liberties. Just think about this. The United States Supreme Court today said that the government can force American citizens to buy a product. Where's it going to stop? We've got to get back to constitutional basics. As your congressman in the 3rd District of Tennessee, I have fought every day to uphold our great Constitution. Today, the Supreme Court of the United States, in my view, eroded it.
In looking at this mandate as a tax paid if you happen to be fined because you don't want to buy insurance, isn't that, I mean, a lot of people, when federal income taxes were put in place, felt that that was unconstitutional. And obviously today we could not run this country in terms of infrastructure, defense, and all these other things without taxes. Won't that be the way this law will eventually be looked at?
Well, Gene, I think we need tax reform in this country, and I think the federal income tax and the tax code is a disaster. Maybe those folks had something right. Certainly, we need to look at tax reform in this country that's fair, that's equitable, and so that the American people can sit down at their dinner table and figure out taxes. We've got to get rid of the tax code. This situation is the federal government with Obamacare taking over 1/6 of our economy. This is wrong, it's unfair, and most of all, the American people don't want it. As long as I'm in Congress, I'm going to continue to fight Obamacare.
All right, Congressman Chuck Fleischman, our time is up. Thank you very much for joining us today.
A number of our 6 News viewers are voicing their opinions tonight on today's historic decision. Let's go ahead and take a look at some of the comments on our 6 News Facebook page. Viewer Rhonda McCriff writes, quote, "The sooner people learn that nothing in this world is free, the better off everyone will be. If you get something free, the rest of us are paying for it," end quote. And Courtney Miller-Rao is happy with the ruling, saying, quote, "Good. This will expand services such as those provided by the health department. I grew up using them, and that's with a growth hormone deficiency. I got excellent care, absolutely wonderful." Meanwhile, Judy Thompson, responding to comments about the November election, is giving our chief meteorologist a nod. She says, quote, "I've made up my mind. I'm voting Matt Hinken for president." Judy, I'm sure he appreciates that, but we'd like for him to keep his day job. Well, as we told you at 5, the Supreme Court upheld a majority of the health care reform championed by President Obama. Now, the move could mean that millions of Americans who don't have health insurance may soon get coverage. But if they choose not to, they could face penalties. 6 News reporter Josh Alt breaks down the ruling and explains what changes are underway for health insurance.
The Supreme Court ruling on the Affordable Care Act today made it clear everyone is going to have to get health insurance. Dr. Carol Myers with UT's College of Nursing has been researching this act.
I'm encouraged that we have something. I would be naive to say it's the final answer and it's the only answer, but I'm glad to see our country doing something to address what I consider to be a very, very serious problem.
Dr. Myers says the biggest change will be for those Americans who don't currently have health insurance.
One is Medicaid expansion, that more people would be eligible for Medicaid under the Affordable Care Act beginning in 2014 than are eligible today.
Through this act, people between 133% and 400% of the federal poverty level will be included in Medicaid. The federal government will pay for this for the first few years, and states will have the option of accepting it. But according to Myers, if they don't, that would be billions of dollars not used to provide health insurance for their residents. And if you aren't covered by Medicaid, there will be government assistance called insurance exchange.
An insurance exchange is basically a virtual market where insurance companies will compete on standard products for your business.
For those who have insurance through their jobs, not much will change. There will be some federal help to small business owners to provide insurance for their employees depending on how many employees they have. If you still don't want to buy health insurance, there will be a penalty or a new tax.
For a family, initially will be about $285 or up to 1% of annual income, whichever is greater, but it will grow to $2,000+ in subsequent years.
Myers says there is no way to know how much health insurance prices will cost because this act does not control price. It is still a market-based product. But she does say the million or so people here in Tennessee who currently are uninsured will have the opportunity to have it very soon. In Knoxville, Josh Auld, 6 News.